Welcome to the training for healthcare professionals. Let us learn about hand washing today. Let's take a look at the key learning objectives. After completing this lesson, you will be able to explain why and when is hand washing done, demonstrate correct hand washing technique. Let us first understand what hand washing is. Click each hotspot to know more. It is the act of cleaning one's hands for the purpose of removing soil, dirt, and other microorganisms. Medical hand hygiene helps to cleanse the hands of pathogens, bacteria or viruses, and chemicals which can cause harm to self or others like patients. Hand hygiene procedures are of three types. Click each image to know more. Routine hand washing using water and soap. Surgical hand scrub usually done before surgery. Use of alcohol rubs or gels when hands not visibly soiled. Hand hygiene should be followed by healthcare worker, doctors attending patients, visitors visiting patients, patients themselves before having any food. Now let's see why hand washing is so important. Click each image to know more. Hands are the main means of contact between surfaces and people. 80% of all infectious diseases are transmitted by touch. Hand hygiene is the most important measure for preventing the spread of infection. Cleans and removes microorganisms from hands. Protects patient and self from infection. Junior nurse Maya is attending a patient in Ward C with head injury. She needs to dress the wound of the patient. She enters the ward and is all set to start the procedure. Senior nurse Asha was around. She stopped Maya and said,
"Aren't you aware of the hand hygiene moments, Maya?"
"Hand hygiene moments? What's that, Nurse Asha?"
Okay, it seems you have not heard of it. Let me tell you the 5 hand hygiene moments when you need to clean your hands without fail.
Click each hotspot to know more. Before touching a patient, before clean or aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surroundings. Some of the additional hand hygiene moments are before commencing work or after leaving work area, before preparing or eating food, before handling medicines, before wearing and after removing gloves, after handling contaminated laundry and waste, after using the toilet, after contact with patients in isolation. Let us now understand the hand washing procedure that we must follow to clean hands from any dirt or microorganisms. Routine hand wash using water and soap takes around 40 to 60 seconds and has 7 main steps. Click each step to know more. Rub palm together. Interface fingers and rub hand together. Rub the back of both the hands. Rub thumb in rotating manner followed by area between index finger and thumb for both hands. Interlock the finger and rub the back of finger of both the hands. Rub fingertip on palm for both hands. Rub wrists in a rotating manner. Rinse and dry thoroughly. Here are some of the important points that you should remember. Don't forget to remove jewelry or wristwatch and roll up sleeves. Use running water at a comfortable temperature. Wet hands thoroughly before applying any soap. Use enough soap to get a visible lather. Rinse thoroughly to remove all soap. Dry thoroughly as microbes thrive in moisture.
First, scrub in and wash your hands properly. Clean hands are essential to prevent infection to the patient. To do a proper hand wash, there are 6 steps. Before starting, remove your ornaments if any. Wet your hands, using the foot valve to turn on the water flow. Take care to wet your wrists and forearms as well. Then, take enough of the cleaning solution into one of your palms. First start by rubbing your palms against each other. Then, one hand over the other hand with fingers interlocking. Clean each hand separately in this manner. Third, clean your palm to palm again with fingers interlocking. Then clean the inner sides of the fingers one hand at a time. Also clean the thumbs one hand at a time. Fifth, clean your nail tips by rubbing them against the opposite palms, one hand at a time. Lastly, rub and clean your wrists with the soap solution. Wash thoroughly after this to make sure all the soap is washed off properly. After this, use the dryer to dry your hands. You could also use paper towels, but make sure your hands do not touch any surface.